How the pandemic has changed our bodies. Regardless of whether you were lucky enough to avoid the coronavirus last year, the global pandemic can still cause damage to your body. The pandemic has changed our lives, and your body may be suffering from major or minor impacts. Whether it's the constant fear of catching the virus, the sudden loss of loved ones or other fellows, social isolation, work losses, and financial hardships, the fear of contracting the deadly virus is common. According to Dr. Ada Stewart, a family physician in South Carolina, and president of the American Academy of Family Physicians, the pandemic has affected citizens' welfare, but not necessarily because of the COVID-19 outbreak. So, before we start learning about how our bodies changed after a year of pandemic, please help this video and channel by giving it a like and hitting the subscribe button. Enjoy. Brain. Coronavirus concerns have kept many worrying through the night. But for some, the pandemic has had a severe effect on their mental health. Nearly 1 in 4 adults, or 23%, reported drinking more alcohol to cope with their stress during the pandemic. Based on the results of a survey of more than 5,000 people, anxiety and depression symptoms have increased dramatically, with 33% reporting anxiety or depression symptoms, 30% reporting COVID-19 related trauma and stress symptoms, 15% reporting increased drug use, and 12% saying they have considered suicide. According to Dr. Ken Duckworth, medical director of the National Alliance on Mental Illness, 43% of respondents reported at least one of these negative mental health symptoms, which is nearly double the pre-pandemic figure. In general, we are very social beings. Human connections are antidepressants and anti-anxiety interventions. Dr. Duckworth encourages people to find innovative ways to remain linked until it is safe to be social again, such as virtual communication or going for walks together outside while keeping sufficient distance. Since the beginning of the pandemic, people have reported shorter or more sleep than they wanted. According to research reports issued by the American Psychological Association and many studies conducted around the world, people's dreams continue to be full of anxiety and negative emotions. Skin and hair. People's skin and hair have changed as a result of the pandemic's impact. One of the most talked about is maskne, a word for acne and facial inflammation caused by wearing masks. The American Academy of Dermatology suggests using a moisturizer before and after wearing a mask, skipping makeup, as well as selecting a mask that fits snugly and comfortably. If you have dry skin on your hands due to constant hand washing, moisturize after each cleaning. Hair loss could arise from stress or possibly a vitamin deficiency from poor pandemic eating habits. Stress and anxiety may lead to the hair pulling disorder, trichotillomania. Teeth. According to a survey conducted by the American Dental Association in February, more than 70% of nearly 2,300 dentists saw a rise in teeth grinding and clenching in their patients due to stress caused by the pandemic. More than 60% of dentists registered growth in stress-related dental problems, such as chipped or broken teeth, and joint injury symptoms like jaw pain and headache. Another factor leading to tooth issues is missing dental appointments during the pandemic. Usually, many people dread going to the dentist, and the fear of catching the coronavirus gave them yet another excuse to avoid it. The delay can lead to further periodontal problems and an increased risk of cavities, where a small chip or fracture that could have been repaired with a simple filling can turn into a large chip or fracture. Your back and neck. When several workplaces closed due to the pandemic, those who worked from home began using computers at their kitchen tables, couches, and beds. Even if they have a desk at home, it might not be properly set up to prevent backaches, wrist injuries like carpal tunnel syndrome, neck strain, and other aches and pains that may result from long hours of computer work done with poor posture. According to experts, full-fledged repetitive stress injuries grow progressively over time and do not manifest for several months or longer. The heart. Patients who slacked off on their diet and exercise regimens during the pandemic, as well as those who skipped scheduled medical appointments to track serious issues of blood pressure and cholesterol, could be at an increased risk. People have put off managing their hypertension or diabetes by not coming in, due to the fear of contracting the flu or simply not leaving the house. Muscles. People struggle to exercise regularly, since gyms and recreational facilities have closed or are available on a limited basis. Sitting for long periods will weaken your backside, which is known as dead butt syndrome. Weight. Some people who have taken refuge at home may have lost weight because they do not eat much. However, they are looking for time to cook healthy meals and exercise regularly indoors. But for the rest of us, the opposite is true. The so-called COVID-19 has had a significant impact on people's waistlines. More than 6 out of 10 people claim they have gained or lost weight since the outbreak began. In April, a major international survey of more than 7,700 adults found that 27% of all respondents registered weight gain around the time of the pandemic's start, with that number rising to 33% for those who were already obese. Weight gain is not surprising, since many people spend more time at home, working on computers and spending more time on activities such as watching TV, baking, and eating snacks. Many gyms have been closed, and pandemic fatigue is deeply ingrained. If you like this video and would like to hear more, be sure to press the subscribe button.